Welcome. Thank you for joining. I'm going to let some more folks join and then we'll start the webinar. Thank you for joining our Predict Healthy Home Study webinar. In this presentation, we'll overview your lead in water, dust, and soil sample results. My name is Jennifer Hopenick-Redman. Together with Erica Wood and Michelle Del Rio, we aim to help you better understand your results. After the presentation, we'll have a live Q&A session as well. Our studies carried out by our multidisciplinary team, including researchers with expertise in risk assessment, public health, fate and transport, community engagement, and risk communication from Indiana University, North Carolina State University, North Carolina Agricultural and Technical State University, New Mexico State University, and RTI International, a nonprofit research institute. In this presentation, we'll provide a background on lead, study motivation and objectives, overview results reports, discuss next steps, and end with Q&A. First, let's go over a background on lead. What is lead? Well, lead is a naturally occurring toxic metal. Given its useful properties, it's had long-standing use in products. We often can't tell, though, when it's been used in products, even through historic use, because it's colorless, odorless, and tasteless. Reductions in lead exposure have happened over time with bans, including bans in leaded paint and bans in lead in gasoline. Lead exposure can still happen in many ways, though. It can happen from chewing on toys or products that contain lead in them, such as lollipops, from paint or plastics, or from the wrapper itself or the candy. It can happen from leaded paint in your household falling to the ground or being gnawed on by children. It can be found in spices and sometimes other foods. You can also bring it home sometimes from occupational exposure to lead. There's also industrial pollution in some areas, like from lead smelters that can create lead in the air, soil, or water around you. And finally, there's also potentially lead in tap water from its allowable use in water infrastructure. There's no safe level of lead exposure, and that's why we aim to prevent lead exposure before it starts. People that are exposed to lead have cognitive and behavioral difficulties, and that can start at any level of exposure, and it is lifelong and irreversible. And this includes lower IQ and learning disabilities. There's also other things that can happen to your body, such as decreased bone and muscle growth, anemia, and nervous system damage. How does lead typically enter your body? It can be inhaled, for example, from leaded dust or in the air, and it can also be ingested, for example, from eating foods or drinking water contaminated with lead, or from touching your hands after playing with soil or playing with a toy, for example. While there can be many different opportunities for lead exposure, the primary sources of lead exposure that we're focused on in this study and in your home are household dust, drinking water, and soil. That's why we're asking for samples of those three when we sent your sample kit to you and analyzed lead in those samples. Now I'll share a bit more on our project motivation and objectives. We all care about our children's health. For lead exposure, we can protect more children if we better predict who will be exposed to lead. Importantly, exposure to lead as an adult can also have health problems and implications, and therefore all households are recommended to try to reduce potential lead exposure because there is no safe level. In the United States, approximately 80% of children are never tested for blood lead. And that's often the way that we typically identify whether a child has had exposure. There is a large societal cost to lead exposure, including almost 51 billion US productivity dollars lost yearly as an estimate. And so our goal in this study is to improve predictions of who is at risk and aim to stop those exposures before they start if we can pinpoint where they are and make changes. Our study is called the Lead Reduction in Critical Homes, or PREDICT study, and the objectives were particularly to, one, link existing data that we have plus new data in North Carolina and Indiana from these household sample kits. Then model this data to create and then test predictive models that allow us to get to the third part, which is predicting risk by developing a web-based app that prioritizes household risk and potential interventions that may be effective. Participants were recruited in a variety of ways, including by mail, door to door, community events, and with community partners, word of mouth, our website, Facebook ads, a selection and a waitlist process, our online training videos, and phone, email, and text message support for individuals that were interested in wanting to learn more. This is our project website, and it offers additional information for anybody who's interested or has already participated in the study. And you can also go there for additional resources after this webinar. Samples that were included in the study to date were shipped back to RTI International, where we analyzed them in our laboratory. Now Erica is going to go over the results reports with you.
So now we'll walk through how to read the results report. And if you'd like, you could have your results report open and available to look at while we walk through together. So the first page is a cover page. You'll see it has our contact information there if you have questions. And it also has a reminder that these results are a snapshot. They give you the results from the samples that you collected at a particular day and time, particular locations around the home. They can't tell you everything about lead potential, possible lead sources in the home, but they can hopefully give you some useful information. You'll have 3 pages of results, one for water, one for dust, and one for soil. They're each organized the same way. We're going to go through what's on the page, how that's laid out. And we'll do that using the water results as an example. And the dust and the soil results are organized the same way. So right there in the center, you'll see your results. That's circled in red. And you'll see it in the table, and it's the same number down in the figure. We just wanted to include that 2 ways, make it easy for you to see whatever way works best for you. And then on the left, we've circled in green there. That's the location where you took that sample. So, for example, in this report, the water sample was collected at the kitchen faucet. For the dust samples, it might say bedroom or living room. It'll say whatever you put on the form that you sent back with your samples. And that's just a reminder of where you collected the sample. Down at the bottom, there's a short paragraph that tells a little bit about where lead might come from that would get into that sample. In this case, it's for the water, the dust page, or the soil page. There are several possibilities of how lead could get there, and we tried to give a little bit of an overview there. And then on the right are the guidelines for comparison. If people want to know these results that I got, if lead was detected, is that a high level, a low level, is it medium? How concerned should I be? And the guidelines can help you know what the government agencies are looking at when they're evaluating for lead hazards. If you're really interested in knowing more about what those guidelines mean and how they're used, we put links for that information on the last page of the report. Like I said, there are the links on the last page of the report. That's the image on the left. And we also have some links there to more detailed information about preventing lead exposure in the home. We also put some links there to more information about generally preventing lead exposure in the home, there are some great resources there. And then the two images on the right are the handout that gives the recommendations from the study team about how to reduce exposure to lead in the home. There are some great links on that too to take you to more detailed information. The handout, you can find it anytime on our website. The QR code at the back end of the report links to that same handout on the website. Also, we linked it in the cover letter with your report. So hoping to make that easy to find. That's a great resource to have on hand, refer back to. Again, like Jenny said, the idea is you want to reduce exposure to lead as much as you can. And you can use the results here from this study to help decide if there's a highest priority for action you want to take. Now I'm going to pause here for questions. You can put the questions in the Q&A box, and we're going to collect those and discuss a bit more at the end. But I did just want to give a moment to pause and let people write about that. After this, Michelle is going to talk a little bit more in detail about those recommended actions, things that you can do to reduce your exposure to lead. And before I pass over to her, like I said, I just wanted to pause here and let people have a chance to write questions or get some questions started if they have them. And then we'll discuss them a little bit more at the end. And whenever you think of it, you're welcome to keep putting questions in.
This is Michelle, and I'll be going over recommendations to get the lead out of your household and reduce your risk to lead exposure. We'll be going over recommendations that we provided with your results report. We provided access to these recommendations with the links pasted here and also in your report. The first step in preventing household lead exposure is identifying if and where lead is in your home. You should contact local and state health departments to find out if help is available for investigating and eliminating lead. You can test your home using a kit like the one you completed for your study, or you can hire a certified lead risk assessor to test your home. We recommend this especially if the building of your home was built before 1978 or if lead was found in dust. A great resource that you can use and that is available to you for testing water is through our RTI's program Clean Water for U.S. Kids. The program has developed opportunities for families to test their water for lead. Families can purchase a home water lead testing kit and submit samples to a lab where scientists will analyze the sample and provide results and recommendations based on the findings. More information about this program can be found at this website. If lead was found in your water, here are a couple of simple recommendations you can take. You can use cold water for drinking or cooking. Flush water regularly, especially after long periods of not use, typically after 2 days. Replace faucet fixture with certified lead-free faucet. And you may also install and maintain a filter that is certified to remove lead. But make sure you change your filter per the instructions. In many cases, if you don't change the water filter as recommended by the manufacturer, you may introduce high concentrations of contaminants into your drinking water. For more questions about filters, go to the shown link. For lead in your dust, there are simple and general recommendations for you and your family that can help control dust and reduce lead exposure from contaminated dust. Some simple recommendations are to wash hands before eating, take off shoes before entering the home, wet mop floors, windows, and surfaces weekly. Make sure it's wet mopping, not dry dusting. Remove loose paint chips carefully with a wet wipe, and brush and wipe down your pet, especially their paws, before letting them inside. Additionally, we recommend to vacuum carpets and upholstery with a HEPA filter vacuum at least weekly. Change air conditioning and heating unit filters at least every 3 months. Do not use or smoke tobacco products in home because this creates more lead contaminated dust inside your home. Replace old and deteriorating vinyl mini blinds because they can create more dust. Another way to reduce contaminated lead is to practice safe home repair, renovations, and painting especially homes built before 1978, and when you learn you have lead in your indoor dust. If possible, hire an EPA lead-safe certified firm and renovators to do the work. This makes sure that they comply with EPA's repair, renovation, and painting rule, which is referred as RRP. For landlords, it is required for them to hold certification if they conduct their own renovations. For homeowners, there is no requirement, but it is recommended to practice safe repair, renovation, and painting so that they can protect their families from lead-contaminated dust generated from these activities. A safe rule to follow is that if your home was built before 1978, then you should follow the RRP guidelines. We also wanted to let you know that there's lead encapsulating paint available at your local hardware store, and this can be used to treat small lead-based paint areas. For more information about RRP, you may visit this link. For contaminated soil, you can reduce your risk by covering contaminated soil with a physical barrier such as turf, mulch, stones, or gravel. For edible gardens, we recommend that you use above-ground beds and purchase soil. For the rest of your yard, you may purchase and add phosphate-based fertilizer. This helps bind potential lead from the ground to the phosphate and prevent it from being absorbed if ever ingested. There can be other sources of lead that increase your exposure and probability of bringing contaminated dust in your home. People who have jobs that work with leaded materials may not only expose themselves to lead at work, but they also risk bringing lead home with them on their clothes. Your job or your hobbies may put you at risk for lead exposure. The most common jobs or hobbies that involve leaded materials are jobs in construction or demolition, working in a factory that melts or welds metal, working as a miner, painting or sanding leaded paint, recycling metal, home renovating, hunting, or working at a firing range, and making or consuming home distilled liquids. Therefore, we recommend to limit such activities if possible and cleaning yourself up after engaging in such activities. You should wash hands after work or hobby or before eating, change into clean clothes before returning home, and wash work hobby clothes separately from other laundry. Additionally, we have other general recommendations to keep reducing lead in your home. Wash your hands immediately before eating. Do not let children play with keys or chew on items not intended for teething. Check for recalled toys, food, jewelry, and cookware and replace them with lead-free options. You may go to this website to check the items. And always keep a nutritious diet by eating foods rich in iron, zinc, calcium, magnesium, and vitamin C. These essential minerals and vitamins help reduce lead absorption. With regard to your family members, we recommend that you monitor your family's exposure, especially for children. Be sure to have your child's blood tested at ages 1 and 2, or at least once if no previous test has been done. Check with your local health departments and health insurance to learn how to cover for blood lead testing. Most of the time, these are free, especially for the young children. We also recommend testing when a child starts a new child care program or school, takes longer trips, meaning staying somewhere for a very long time, eating soil or other unusual behaviors, unexplained cognitive or behavioral concerns or illnesses, including anemia. Thank you, everyone. We have reached the end of the webinar. We're now opening up the floor for questions and comments. We also want to let you know that if for some reason you know of others who were planning to come to the webinar and they missed it, please let them know that we'll be having more webinars in the future so that others can participate. So please continue sharing the word.